Hello everyone. So today we are talking about water-soluble vitamins. Previously in our discussion in chapter 7 we talked about the fat-soluble vitamins. So today again we're talking water-soluble vitamins. There are 9 of the water-soluble vitamins, including 8 in the vitamin B complex and vitamin C, which is ascorbic acid. So here we go. So as I mentioned, there are 9 vitamins in the water-soluble vitamins, and the B complex vitamins include thiamine, riboflavin, niacin, B6, B12, folate, biotin, and pantothenic acid. Choline, although it's included in the DRI for the B vitamins, has not been classified as a vitamin at this time. Being water soluble, they are not, with a few exceptions, stored to any significant extent in the body. The effects of a deficiency may be noted in 2 to 4 weeks for some of these vitamins, often reducing physical performance capacity. Excessive supplements of these vitamins are usually excreted in the urine and are generally considered to be relatively harmless. However, there are some exceptions. Because several of the B vitamins work closely together, and energy metabolism, many studies have investigated the effect of a deficiency or supplementation of multiple vitamins from the B complex. A summary of this research follows a discussion of each of the different vitamins. Roles of vitamins are important to sport performance. A number of B vitamins, including thiamine, riboflavin, niacin, B6, and pantothenic acid, are essential for the conversion of carbohydrate into energy for muscular contraction. Vitamin B12 and folic acid are essential for the development of the red blood cells, or RBCs, which deliver oxygen to the muscle cells. Vitamin E helps protect the RBC membrane from destruction by free radicals. Vitamin E and other antioxidant vitamins are theorized to prevent free radical damage in muscle cells during exercise. Vitamin C is needed for the formation of epinephrine, or adrenaline, a key hormone during strenuous exercise. Niacin may actually block the release of free fatty acids from the adipose tissue, which could be a disadvantage for ultra-endurance athletes. Finally, several of the B vitamins are also involved in the formation of neurotransmitters in the brain, which may induce a relaxation effect. This is a chart going over, of course, each vitamin and, of course, the RDA and DV daily value of each and their sources. We're going to be talking about each of them as well. And this is just another extension of that. It's talking about the major functions in the body, as well as deficiency symptoms and symptoms of excessive consumption. Again, we'll be going over each of them. So thiamine is considered to be B1, and it is a water-soluble vitamin, also known as the antiberiberi or antineuritic vitamin. It was one of the first vitamins discovered. The RDA for thiamine varies according to the intake of calories, being approximately about 0.5 milligrams per 1,000 calories. The average adult male needs approximately 1.2 milligrams per day, while the adult female needs about 1.1 milligrams per day. Thiamine is widely distributed in both plant and animal tissues. Excellent sources include whole grain cereals, beans, and pork. One lean pork chop contains more than 50% of the RDA. Several fortified ready-to-eat cereals contain 100% of the RDA for thiamine, as well as most of the other B vitamins. Thiamine has a central role in the metabolism of glucose. It is important. It is a part of a coenzyme known as thiamine pyrophosphate, which is needed to convert pyruvate into acetyl-CoA for entrance into the Krebs cycle. Thiamine is essential for the normal functioning of the nervous system and energy derivation from glycogen in the muscles. Deficiency symptoms may occur in several weeks and include loss of appetite, mental confusion, muscular weakness, and pain in the calf muscles. Prolonged deficiencies lead to beriberi, a serious disease involving damage to the nervous system and the heart. Fortunately, thiamine deficiency is not very common. although it may be very prevalent among the homeless, alcoholics, and other special groups. Of importance to the athlete, two factors that increase the need for thiamine are exercise and high carbohydrate intake. A deficiency of thiamine could prove to be detrimental to the active individual who might rely on high levels of carbohydrate metabolism for aerobic energy production during exercise, such as endurance athletes. Indeed, some well-controlled research conducted during World War II to evaluate military nutrition needs in combat noted decreased endurance capacity for several weeks of a thiamine-deficient diet. More contemporary research has also investigated the role of thiamine deficiency on exercise performance, but in conjunction with riboflavin and niacin deficiencies. Thiamine supplementation apparently has no health benefits for a well-nourished individual. Thiamcor found no evidence of thiamine toxicity with oral administration, as the excess will be excreted in the urine. No upper limit has been set for thiamine. No contemporary research appears to exist relative to the effect of thiamine supplementation upon physical performance, although results from a number of studies conducted more than 50 years ago are available. Following a careful review of these studies, many of which problems in establishing a proper experimental design, there appears to be no conclusive evidence to support the contention that vitamin B1 intake above and beyond the normal RDA will enhance performance. So prudent recommendations: thiamine supplements are not needed by the individual who is consuming an adequate diet, and they do not appear to enhance exercise performance. So main thing is to make sure that you are getting it through nutrient-dense foods in your diet. Riboflavin, on the other hand, is vitamin B2 and is, again, a water-soluble vitamin and a component of the B complex. The RDA for riboflavin is 1.3 milligrams for the adult male and 1.1 milligrams for the adult female. The DRI table on the inside front cover contains the RDA for other age groups. The daily value is currently 1.7 milligrams, and there is no upper limit that has been established. Riboflavin is distributed widely in foods. A major source is milk and other products, dairy products. One glass of milk contains 20% of the RDA. Other good sources include liver, eggs, dark green leafy vegetables, wheat germ, yeast, whole grain products, and enriched breads and cereals. Riboflavin is important for the formation of several oxidative enzymes known as flavoproteins, which are involved in energy production from carbohydrate and fats in the body cells. It is also involved in protein metabolism and maintenance of healthy skin tissue. Deficiencies are very rare, but have been seen in alcoholics and those adhering to various fad diets. Early signs of deficiency include glossitis, which is an inflammation of the tongue, cracks at the corner of the mouth, and dry, scaly skin at the corners of the nose. Symptoms common in individuals who experience multiple nutrient deficits. Although the effect of a riboflavin deficiency on physical performance has not been studied directly, research from Cornell University suggests that physically untrained women who initiate an aerobic training program may need a higher intake of riboflavin to synthesize more flavoproteins in the muscles. Using a blood test, the investigators determined that the RDA did not maintain proper riboflavin status in the early stages of training, but they suggested that a value of about 1.1 milligrams per 1,000 calories would be sufficient. It should be noted that no data were reported relative to this effect of this deficiency on performance. Harold Lumby also reported a possible deficiency in trained athletes, but did not relate it to performance. Most recently, Wolf and Menor reported that although athletes may need more riboflavin than the general population and the current RDA, they can satisfy these needs if adequate energy is consumed, and they currently appear to be meeting recommendations. Riboflavin supplementation apparently has no health benefits for a well-nourished individual. McCormick indicates that toxicity for excess riboflavin intake is doubtful. Excesses will not be stored but will be excreted in the urine. No upper limit has been set for riboflavin. Reviews by Keith and Vanderbeek reveal only one reputable study of the effects of riboflavin supplementation on physical performance. Tremblay and others studying elite swimmers reported that 60 milligrams of riboflavin daily for 16 to 20 days did not improve VO2 max, anaerobic lactate threshold, or their swim performance. Considering the available research data and the absence of riboflavin deficiency in most individuals, one must conclude that riboflavin supplementation will not enhance health or physical performance. Niacin, or vitamin B3, also known as nicotinic acid or nicotinamide, or the anti-pellagra vitamin, is of course a water-soluble vitamin in the B complex, and sometimes is erroneously referred to as vitamin B3. Niacin is found naturally in many foods, but it also may be formed in the body from excess amounts of dietary tryptophan, an essential amino acid. Therefore, the RDA is expressed in niacin equivalents, or Ne. 1 Ne equals 1 milligram of niacin or 60 milligrams of tryptophan, because 1 milligram of niacin can be produced from the amount of tryptophan. The RDA for niacin is 16 NEs for adult males and 14 NEs for adult females. This requirement is different from other age groups, and specific values may be obtained from the DRI table on the inside front cover. The daily value is 20 milligrams. Because excess niacin intake may cause some health problems, as we will talk about, an upper limit of 35 milligrams per day has been set for adults, and even lower amounts for younger individuals. Food source niacin is found in foods that have a high protein content. It is most abundant in lean meats, organ meats, fish, poultry, whole grain cereal products, legumes such as beans and nuts, peanuts, and enriched foods. Milk and eggs contain small amounts of niacin, but they contain sufficient tryptophan. 1/2 of a chicken breast contains more than 60% of the RDA of niacin. Niacin serves as a component of 2 coenzymes concerned with energy processes within the cell. One of these coenzymes, nicotinamide adenine dinucleotide, or NAD, is important in the process of glycolysis, which is the means by which muscle glycogen produces energy by both aerobically and anaerobically. The other coenzyme is involved in fat metabolism by promoting fat synthesis in the body, which may block the release of free fatty acids from adipose tissues. Although niacin deficiency was prevalent in the past, the enrichment of foods with niacin has nearly eliminated this problem. Deficiency symptoms include loss of appetite, skin rashes, mental confusion, lack of energy, and muscular weakness. Serious deficiencies lead to pellagra, a disease characterized by severe dermatitis, diarrhea, and symptoms of mental illness. In theory, physical performance would be impaired by a niacin deficiency because the production of energy from carbohydrate could be impaired. Both aerobic and anaerobic type performances could be affected. However, no research has been uncovered that has directly studied the effects of niacin deficiency alone on exercise performance. Megadoses of niacin may function as drugs and have been used in attempts to treat several health problems, being relatively ineffective in the treatment of mental disease and somewhat successful in reducing high serum lipid levels. McKinney noted that niacin favorably affects all components of the lipid profile to a significant degree, as it has consistently been shown to significantly reduce levels of lower total cholesterol, LDL cholesterol, triglycerides, and lipoprotein A. In particular, niacin has a very potent effect to increase HDL cholesterol by blocking the uptake of apolipoprotein A1 by the liver. Some indicate that it is the best drug for this purpose. Niacin may be useful as a therapeutic treatment of dyslipidemia. In several reviews of clinical studies, Hennehaek and Bourgeois revealed that niacin, either alone or combined with other agents, can result in regression of atherosclerosis and reduce patient mortality. However, results from the AIM-HIGH trial showed that niacin did not provide any additional protection against heart attacks when taken with the cholesterol-lowering drug Zocor, also known as simvastatin, but it did increase risk of stroke. Surprisingly, patients ingesting niacin and Zocor had increased HDL levels and decreased triglycerides, but there was no benefit in terms of disease outcomes. Although medications that reduce LDL are clearly beneficial, there is less evidence that nutrients and medications that increase HDL and decrease triglycerides are as effective at reducing heart disease risk. Given these rather contradictory research findings, individuals with cardiovascular disease should adhere to their physician's recommendations. Although niacin is generally considered to be non-toxic, large doses in the form of nicotinic acid may cause flushing with burning and tingling sensations around the face, neck, and hands occurring within 15 to 20 minutes after ingestion. It's like a histamine-like effect. Taken over long periods, niacin may contribute to liver problems such as hepatitis and peptic ulcers. Piper noted that niacin comes in 3 formulations: immediate release, sustained release, and extended release. Niaspan, an extended release niacin preparation, appears to minimize the flushing effects seen with the immediate release form and the hepatotoxic effects seen within the sustained release form. In their review, Guyton and Bayes concluded that overall the perception of niacin side effects is often greater than the reality, and thus, as a result, a valuable medication for cardiovascular risk is underused. Nevertheless, the American Heart Association and the National Institutes of Health recommend that no one take niacin to lower blood cholesterol without guidance from a physician. Because of the role of niacin in energy metabolism, a number of experiments have been conducted relative to niacin supplementation and physical performance capacity. However, several reviews concluded that niacin supplementation has not been shown to be an effective ergogenic aid for well-nourished athletes, having no effect on various exercise endeavors, including performance in a 10-mile run and a 3.5-mile cycle time trial following 2 hours of cycling. As a matter of fact, niacin supplementation is not recommended for athletes, particularly those involved in endurance-type activities, such as marathon running, because excessive niacin intake, about 3 to 9 grams per day, influences fat metabolism, blocking the release of free fatty acid from the adipose tissue. This will decrease the supply of FFA to the muscle, which may lead to an increased dependence on carbohydrate as an energy source during exercise, as shown by Heath and others. This could lead to a more rapid depletion of muscle glycogen, which is an important energy source during exercise. As noted by Bulow, niacin supplements may reduce endurance capacity. Unless recommended under the treatment of a physician, niacin supplements are not recommended for a physically active individual on a balanced diet. Excessive intake may actually impair certain types of athletic performance and elicit adverse health effects. Vitamin B6, or pyroxidine and related compounds, is a collective term for 3 naturally occurring substances that are all metabolically and functionally related: pyroxidine, pyroxidol, pyridoxal, and pyridoxamine. Pyridoxine is most often used as a synonym. Vitamin C is a water-soluble vitamin. The adult RDA for vitamin B6 is 1.3 milligrams per day for ages 19 to 50, and then increases to 1.7 milligrams for males and 1.5 milligrams for females over age 50. Slightly different amounts are needed at different age levels, so you want to consult the DRI table in the front cover of the text for specific RDA. Actually, the RDA for vitamin B6 is based on protein intake, so requirements may increase with high protein diets. The daily value is 2 milligrams. As excess B6 intake may cause some health problems, A UL, or upper limit, of 100 milligrams per day has been set for adults and even lower amounts for younger individuals. Vitamin B6 is widely distributed in foods. The most reliable sources are protein foods such as meats, poultry, fish, wheat germ, whole grain products, brown rice, and eggs. 1/2 of a chicken breast contains about 25% of the RDA. In its coenzyme form, primarily pyridoxal phosphate, or PLP, vitamin B6 is critically involved in the metabolism of protein, but it is also involved in carbohydrate and fat metabolism. It functions with more than 60 enzymes in such processes as the synthesis of dispensable amino acids, the conversion of tryptophan to niacin, the formation of neurotransmitters in the nervous system, and the incorporation of amino acids into body proteins such as hemoglobin, myoglobin, and oxidative enzymes. It is also involved in the breakdown of muscle glycogen as well as gluconeogenesis in the liver. Interested readers are directed to the review by Wolf and Minor for more details on the metabolic functions of vitamin B6. Vitamin B6 deficiency is not considered to be a major health problem. The average American diet appears to provide an adequate amount of the vitamin, but poor diets do not. The use of diuretics and oral contraceptives has been associated with deficiencies. Wolf and Minor reported that studies have found poor vitamin B6 status in some athletes, particularly in endurance athletes. Female athletes on low energy diets may also have low vitamin B6 intakes. Deficiency symptoms include nausea, impaired immune function, skin disorders, mouth sores, weakness, mental depression, anemia, and epileptic-like convulsions. Theoretically, a B6 deficiency could adversely affect endurance activities dependent on oxygen, for it is involved in the formation of protein compounds such as hemoglobin that are essential to oxidative processes. Its role in carbohydrate metabolism, particularly muscle glycogen utilization, is also important to the endurance athlete. Its role in the formation of neurotransmitters could be important to athletes engaged in fine motor control sports such as archery and riflery. In addition, the requirement for vitamin B6 increases with protein intake, which may have implications for athletes who may be on a high protein diet. However, because B6 is found in protein products, it should be easily attainable in such a diet. No research has been uncovered that has directly studied the effect of B6, a deficiency on physical performance. One report did suggest that runners who covered 5 to 10 miles per day appear to use more B6 than their sedentary counterparts, but these investigators also noted that exercise may actually promote storage of the vitamin in the athlete, thus helping to prevent a deficiency state. Serum levels of B6 actually increase during exercise. Wolf and Minor indicate that exercise increases plasma levels of PLP, which can be converted into an acid and lost in the urine during exercise. Thus, exercise may increase the turnover and loss of vitamin B6 from the body. Vitamin B6 supplementation has been used to treat the nausea of pregnancy, mental depression associated with the use of oral contraceptives, and premenstrual syndrome, or PMS. But its effectiveness for these purposes has received mixed reviews. For example, in a systematic review, Wyatt and others found that conclusions are limited due to the poor quality of the most studies, but doses of 100 milligrams per day of B6, which coincides with the upper limit, are likely to yield benefits in the treatment of PMS symptoms. As discussed later, folate supplementation may decrease plasma homocysteine levels, which has been studied as a risk factor for cardiovascular disease or coronary heart disease, CHD. McKinley and others noted that although not as effective as folate, low doses of B6, 1.6 milligrams per day, may provide additional homocysteine lowering level benefits to elderly individuals who have adequate intake of the other vitamin B vitamins. B6 has also been studied as a part of a B complex supplementation for prevention of CHD, and the results are presented later in the chapter. Wolf and Minor suggests that some active individuals, depending on training level, may require 1.5 to 2.5 times the current RDA for B6 to maintain good B6 status. Several reports relative to the effect of B6 supplementation on physical performance are available. Although the muscle may store B6, Coburn and others noted that B6 supplementation did not markedly increase muscle stores. Moreover, in general, the studies reveal no significant effect on metabolic functions during exercise or the capacity to do more work. One investigator suggested that B6 may actually be detrimental to endurance athletes because it may facilitate the use of muscle glycogen and lead to an earlier depletion in prolonged events. However, in a study from the laboratory at Oregon State University, Burke and others reported that B6 supplementation of 20 grams per day for 9 days did not influence either positively or negatively performance of trained males in an exhaustive aerobic endurance exercise task just under 2 hours in duration. Vitamin B6 supplementation does not appear to be warranted for the physically active individual and may be associated with some health risks if consumed in large doses for prolonged periods. Vitamin B12 or cobalamin is a water-soluble vitamin. It is part of the B complex and is the latest vitamin to be discovered. The adult RDA for B12 is 2.4 micrograms per day. The average diet contains about 5 to 15 micrograms. Slightly different allowances are made for other age groups. Note that recommendations for individuals over age 50 are to obtain the RDA from fortified foods or supplements. The daily value is 6 micrograms, and there are no upper limits available. Vitamin B12 is found in good supply only in animal foods such as meat, fish, poultry, cheese, eggs, and milk. 1 glass of milk contains nearly 30% of the RDA. It is not found in natural plant foods such as fruits, vegetables, beans, and grains, but vitamin-fortified cereals may be an excellent source. It is present in microorganisms such as bacteria and yeast, which may be found in plant foods, but the bioavailability of B12 from these sources is uncertain. Although B12 may be produced by microorganisms in the human bowel, the site of production is below the point of absorption. Vitamin B12 is a part of coenzymes present in all body cells and is essential in the synthesis of DNA. It works closely with folic acid, and both have important roles in the development of red blood cells. Vitamin B12 is also essential for the formation of the protective sheath around nerve fibers, such as the myelin sheath, and for the metabolism of homocysteine. Deficiency of vitamin B12 in humans due to inadequate dietary intake is rare. Even strict vegetarians appear to receive enough in their diet through either the consumption of microorganisms or the use of fortified products. The body also stores a considerable amount in the liver, which may last for years. The body contains about 2,500 micrograms, but loses only about 1 microgram per day. A deficiency normally is caused by the inability to release cobalamin from food or a deficiency of intestinal absorption due to a decreased transport protein. The major symptoms are a severe form of anemia known as megaloblastic or pernicious anemia and nerve damage that may cause paralysis. Pregnant women, particularly vegans, need to obtain adequate B12 because a deficit may impair myelation and cause birth defects in the newborn. Aging affects the absorption of B12 when it is present in food and bound to protein. The use of certain medications such as proton pump inhibitors, histamine 2 receptor antagonists to decrease the production of gastric acid may adversely affect the absorption of vitamin B12. Lamb and others compared almost 26,000 patients with vitamin B12 deficiency with almost 125,000 controls and reported an association between previous or current use of gastric acid inhibitors and vitamin B12 deficiency. Because of its role in the formation of RBCs, a deficiency of B12 resulting in pernicious anemia would be theorized to decrease aerobic endurance capacity. No research is available relative to the effect of a vitamin B12 deficiency on performance, but other types of anemia have been shown to impair exercise performance. B12 megadoses may be an effective medical treatment for pernicious anemia, but do not appear to benefit the active individual who eats a balanced diet. However, as noted below, lower dose supplements may be recommended for some individuals. Relative to sports, vitamin B12 has been one of the most abused vitamins in the athletic world, with some reports of athletes receiving large amounts of injection just prior to competition. The belief probably exists that if a little vitamin B12 can prevent anemia, then a lot of it will do something magical to increase performance capacity. However, several well-controlled studies conducted with B12 supplementation reached the general conclusion that it will not help to increase metabolic functions such as VO2 max or endurance performance. B12 supplements appear to be safe but do not appear to benefit the active individual on a balanced diet. Individuals who consume animal products normally do not need vitamin B12 supplements, and there are no sound data that supplementation will enhance sports performance. However, vegans should consume food products fortified with B12. Additionally, individuals over age 50, including senior athletes, may have decreased intrinsic factor and limited B12 absorption from natural B12 food sources. So, they are advised to get about 2.4 micrograms of B12 from fortified food products such as cereals or supplements. One serving of B12 fortified cereal contains about 1.5 micrograms, whereas a senior multivitamin usually contains 25 micrograms. And that ends our discussion today. This is part 1 of the water-soluble vitamins. We're going to be picking up the second part of water-soluble vitamins in our next session. I'll talk with you soon. Have a great day.